Hi, this is almost everything you'll need to know about the scapulo-humeral muscles. The scapulo-humeral muscles is the third and final group of shoulder girdle muscles that we'll be talking about. The scapulo-humeral muscles is a group of 6 muscles, unlike the other two groups which were 4 muscles each, but the scapulo-humeral muscles can be subdivided into a group of rotator cuff muscles, which is 4 of them, and the other 2 muscles. This is the table in your book that summarizes the scapulo-humeral muscles. The 4 rotator cuff muscles are Supraspinatus, Infraspinatus, Teres minor, and subscapularis, and the other 2 muscles are Teres major and deltoid. Looking initially at an anterior view, we'll see that the muscle subscapularis attaches proximally to the entire subscapular fossa of the body of the scapula on the costal surface, and its distal attachment is the lesser tubercle, and an area just below that, just distal to the anatomical neck of the humerus. It's quite a wide attachment. It's a very strong muscle and looks something like this. By imagining shortening of the muscle, you could probably understand that it is a medial rotator or internal rotator of the shaft of the humerus. But like the other rotator cuff muscles, it has an important secondary function, which is stabilization of the glenohumeral joint. And we'll talk more about that once we've seen the other rotator cuff muscles. The other 3 rotator cuff muscles are all features of the posterior surface of the scapula and humerus. So the first we'll see is supraspinatus. So the muscle belly fills the supraspinous fossa here. That's the fossa above the spine of the scapula for those who are joining the broadcast a little late. And the tendon stretches out, runs under the acromion, just closely related to the head of the humerus, and attaches to the most superior facet on the greater tubercle of the humerus. Shortening of the muscle results in movement of the greater tubercle back under the acromion, and that results in abduction of the humerus, abduction of the arm. Supraspinatus is said to be responsible for the initial 15 degrees of abduction of the arm, after which the deltoid muscle can take over. The next muscle is infraspinatus, so filling the infraspinous fossa on the dorsal surface of the scapula, and a larger muscle, its tendon occupies the middle facet on the greater tubercle, and its action is to externally or laterally rotate the humerus and arm, and it's joined in this function by its small friend Teres minor, which has its proximal attachment on the lateral border of the scapula, the axillary border, and stretches across to the most inferior and posterior of the facets of the greater tubercle. So together these 3 posterior muscles mirror, if you like, the subscapularis on the anterior surface of the scapula and humerus, and the combined function of these muscles is to rotate the head of the humerus about in the glenoid cavity, so hence rotators, and they also form a cuff which helps to hold the head of the humerus in the glenoid cavity. There are very few other elements that provide stability to the shoulder joint. The shoulder is a highly mobile joint, and the trade-off for mobility is always stability. The shoulder is the most dislocated of the large joints of the body, and that's to do with a lack of bony stability and also fairly weak joint capsule and fairly weak extracapsular ligaments. The rotator cuff muscles are by far the most important element in providing stability to the shoulder joint. In fact, they're so strong that often a dislocation of the shoulder, when it tends to fall out inferiorly, is associated not with tearing of the tendons of the rotator cuff muscles, but sometimes with fracture of the greater tubercle itself, and the greater tubercle is left suspended by the rotator cuff muscles where it should be, while the rest of the humerus moves off inferiorly. Happily enough, when the usual reduction maneuvers put the shoulder back in the appropriate place, the head of the humerus comes to lie where it should, and the greater tubercle is there waiting for it, if you like. And when the normal alignment is restored, the tubercle is allowed to heal itself back on. The fracture heals over the usual 6 weeks. The first of the two non-rotator cuff muscles is teres major. That is a much larger muscle, hence the name, and its proximal attachment is the inferior angle here of the dorsal surface of the scapula, and it stretches across to its distal attachment, which is the medial lip of the intertubercular groove of the humerus. So that's actually on the anterior surface of the humerus. So we'll just have to imagine that. So teres major actually moves anteriorly as it progresses laterally, and it is a much stronger muscle. Its distal attachment on the more distal part of the shaft of the humerus means that it's less concerned with stability and more concerned with movement of the arm, and that movement is against strong adduction of the arm, or bringing the arm back to the anatomical position, if you like, from whichever position other muscles have moved it to. So it's a very strong movement. It's joined in that movement by other very strong muscles, such as pectoralis major from the anterior group and latissimus dorsi from the posterior group of axio-appendicular muscles. The axilla is the tissue space in front of these muscles. It's the area where the neurovascular bundle for the upper limb resides and is distributed from, and there is this interesting gap you can see in the posterior axillary wall, and that is for structures to move to and from the axilla. The gap is partially divided by the long head of triceps muscle, which emerges from its proximal insertion, which you may recall is the infraglenoid tubercle of the scapula. Initially it's in front of teres minor here, but as it moves inferiorly it escapes from the axilla and crosses posteriorly over the teres major muscle. It's a muscle which we'll talk about when we consider arm muscles, but it's important here because it divides that triangular gap up into two smaller spaces, and the remaining triangular space medially is called the triangular space, and this more quadrilateral space left behind laterally is the quadrangular space. And through those spaces emerge structures that are escaping from the axilla. So from the triangular space, one structure emerges, which is the circumflex scapular artery, and its circumflex means to move around in a bit of a circle, like circumnavigate, and the circumflex scapular artery is moving around the lateral border of the scapula from anterior to posterior. From the quadrangular space emerges an artery also, which is the posterior circumflex humeral artery, and it moves around the surgical neck of the humerus. And also from the quadrangular space emerges an important nerve, the axillary nerve, escaping from the axilla and also moving around the surgical neck of the humerus. First of all, it gives a branch to supply the teres minor muscle, and then its major branches spread out in this fashion. That is there to supply the final muscle in the scapulo-humeral group, which is the deltoid muscle. So the deltoid muscle has its proximal attachment along this horseshoe-shaped or U-shaped bony construct from the lateral clavicle, the acromion, and the spine of the scapula, and stretches down to the deltoid tuberosity of the shaft of the humerus. In this way, it's a very bulky triangular shaped muscle, or delta shaped, and overlies the axillary nerve that has emerged through the quadrangular space and is supplied by it. Its posterior fibers can extend the arm backwards. Its middle fibers take over from supraspinatus and complete abduction of the arm throughout the rest of its range of movement, which is considerable. And the anterior fibers contribute to forward flexion of the arm. So that's a wrap for the scapulo-humeral muscle group. I'll just point out that the definition of the lower border of the axilla is the lower border of teres major here, and some of you might have noticed this intriguing triangular interval here just below the teres major muscle, and this triangular interval also will be of interest to us in our discussion of the arm. We'll look now at another image just to help solidify our understanding. So we can now readily identify supraspinatus, this pin here, infraspinatus, this pin here, and teres minor. We see teres major here. It's not shown to be a particularly bulky muscle in this diagram, but we can certainly identify it by its position and the fact that it's moving anteriorly in front of the shaft of the humerus here. And we can see the quadrangular space here, and imagine the triangular space here. It's not shown particularly well in this diagram. Again, the lower border, inferior border of teres major is the inferior border of the axilla, the space between the upper limb and the body wall. It's always valuable to consider the anatomy in a living being. So here we have a fine display of the shoulder girdle muscles by a boxer. This is Manny Pacquiao, probably the greatest pound-for-pound boxer of the modern era. We can see the impressively hypertrophied by exercise and training teres major here. Above it would be infraspinatus, and between the two of those, teres minor. Latissimus dorsi sweeping up from the posterior thorax, and its tendon joining the teres major muscle, and in fact winding in front of teres major muscle, both heading for the intertubercular groove of the humerus, the spine of the scapula, and above that would be supraspinatus, but it's covered by trapezius muscle. We can of course see the, again, well hypertrophied deltoid muscle, common in boxers, and the triceps muscle with the long head of triceps angling in towards the infraglenoid tubercle. Some of the fibers of serratus anterior here, the rest of them hidden under pectoralis major, but we know they're there and sweeping towards the medial border of the scapula in this sort of fashion. So that is almost everything you need to know about the scapulo-humeral group of muscles, and that concludes our survey of the shoulder girdle. I hope you found that informative. The videos are obviously able to be rewatched for those with a strong constitution. We'll discuss the axilla and then move on to the arm muscles in future videos. Until then, enjoy the rest of your day.